Hi there, it's Dan Hicks, Judge. I'm here with Kathy Goodwin from Cogdell. We're going to go over our daily briefing. I asked Kathy to come back because there were some things we missed on Friday
Mhm.
that didn't get caught in the video, but there's also some new information that we want to put out. So I'm going to go over a few things real
Okay.
quick, and then we'll get into the new information. The first thing is that in the state of Texas, on the DSH website, which is the Texas Department of State Health Services, total tests in Texas is 85,357. The county's reporting is 157 of 254. There are 7,276 cases reported throughout the state, and there's 1,153 people in Texas hospitals with coronavirus, and there have been 140 fatalities throughout the state. In Scurry County, we've had 11 tests, um, 0 cases reported, 0 fatalities, of course, and then we have 1 pending test. So that's where we stand right now in Scurry County. On Friday, Commissioners Court voted to extend the stay-at-home order through April 21st, and of course, there are portions. The governor's order is through April 30th. So there are a lot of areas that the governor's order supersedes, but we can make ours more restrictive. To some areas, it is more restrictive. Other ways, it's not. Um, we also need all businesses to do what's called a DSO, or a disaster summary outline. And when you fill that out, and this is every business in Scurry County, and the reason for this is if you will fill this out, then there's more chance that you'll be able to get FEMA money. If you don't, you won't get FEMA money. So go to the county website, co.scurry.tx.us, and you'll see a link that has a DSO form on it. Click on that link, fill that out as much as you can, and get it to the auditor's office or to this website. It's covid.dso@co.scurry.tx.us. If you have any further questions, go to the link, find that. And like I said, this is for every business in Scurry County. We'll get more information out in the next couple of days. But we need this information so we can get a big picture of what's going on with our county and how much loss we have with this disaster. So with that, let's go to Kathy. And we started talking the other day about uh, donations that
Mhm.
Cogdell is accepting. And do
Mhm.
you want to go back over those real
Yes,
quick?
sure will. So right now we're looking for any community businesses or individuals that might have some either surgical masks or N95 masks.
Mhm.
Also, any gloves that are new, unopened in boxes, disinfecting wipes, Clorox and Lysol wipes, and the such, hand sanitizer, baby wipes, and then goggles, any kind of protective eyewear.
Okay.
Those are all things that we are using a lot more than normal of, and the supply
Mhm.
chain is tight right now. So we're not at a desperate stage, but we are trying to anticipate future needs
Mhm.
and would welcome any of those donations. There's a box outside the front of the hospital. It's a blue recycling box,
Okay.
and donations can be just dropped off there.
Oh, great, great.
Mhm.
Okay. So if you have any extra personal protective equipment, especially the ones mentioned, donate them to
Mhm.
Cogdell. They could certainly use them out there. They go through them quite a bit, and they're our first line in this disaster. So
Mhm.
thank you.
Yes, thank you. Friday, that
Hmm.
everyone should be wearing a mask when out in public. This this is, and the thought behind this is there are a lot of asymptomatic people walking around. That means you may not have any symptoms at all, but you
Hmm.
may actually have the coronavirus. So by wearing a mask, it will help possibly lessen the chance of you transmitting the disease to somebody else or the
Hmm.
virus to somebody else. So that's the thought process behind it.
Okay.
Wearing a handmade mask will not really protect you from getting the virus. It's
Right.
more to keep the germs to yourself.
Okay.
It's also it helps remind us not to touch our faces. Can't overemphasize the importance of washing your hands,
Hmm.
not touching your face, coughing and sneezing into your elbow instead of into your hand, and then again washing your hands, washing your hands. On top of that, the social distancing, super super important. At least 6 feet. And some
Hmm.
studies now are showing it really should be even greater than that. 6 feet is a minimum.
Okay.
So really, social distancing, staying home, not going out unless you have to, are all really important. And this is just one more small layer of recommendation to help slow down transmission.
Okay. Okay. That's great. Well, I'll be wearing mine. I've
Mhm.
got one, so I'll be wearing one. So if you see me out in public, you don't
Mhm.
recognize me. I'm wearing a mask. You might recognize me with a hat though, because I wear my hats all the time. Um, all right. Where were we next? Now, there was also talk about businesses
Mhm.
requiring their employees
Mhm.
to wear a mask. Also, what are your
Mhm.
thoughts on that?
I think the same principle is applicable to businesses.
Hmm.
Especially ones where you can't practice the social distancing guidelines. So if you have employees that are working in close proximity to others, definitely this would be something that would not hurt and may help.
Okay.
Um, the the ones who can practice social distancing may not be as important, but it's not going to hurt anything, and it
Right.
probably just be a practice that would be good to get used to right now.
Okay. And is that for any business or
Hmm.
just the ones that are open to the public
Hmm.
or?
I would say probably any business that you're
Okay.
that you're working in close proximity with anybody else. You may
Gotcha.
not be serving the public, but your coworker doesn't need,
Sure.
you don't need to spread it to your coworker and vice versa.
Okay.
Hmm.
All right. Yeah, that makes absolute
Hmm.
sense. Um, all right. So we heard something about we heard something this morning
Hmm.
about a business that sent an employee home because they had or told them they couldn't
Hmm.
come back to work until they had a letter or a negative test
Yes.
is what way I
Yes.
understand it. Because they had some type of symptoms.
Yes, so we're starting to see this a little bit more where
Mhm.
employers in town are sending their employees to us. Maybe they had a fever or cough, or maybe they had traveled, and they're sending them to us to get tested for the coronavirus, and they don't
Mhm.
let them come back to work until they're tested and it's negative. The problem is, we're not everyone even all the criteria.
Mhm.
The main reason we test is to, if it's going to change the course of your treatment. So really, it's for those very ill that it can make a difference on what we're going to do in terms of how we take care of you, and then
Okay.
healthcare workers
Right.
with symptoms. Those are the highest priority right now for testing. So just because an employer sends an employee to us, we can't test them necessarily. They have to
Right.
meet quite a bit of criteria. So we do have a letter that we are sending back with those employees, and it gives guidelines for uh, monitoring your symptoms at home,
Mhm.
quarantining if they feel like they have the symptoms and they're at risk for having the coronavirus, but they're not being tested. They could be recommended that you would stay home for 14 days and
Mhm.
self monitor and basically quarantine yourself. So we do have a letter for employers that we can send back, and it basically says that we've seen this person, but we cannot test them,
Okay.
and it gives them a little bit of recommendations.
Okay. All right. Very good. Very good. No, no, no. What else was there? I think that pretty much covers all of those,
Mm-hmm.
but we
Okay.
want to still remind people that
Mm-hmm.
we need to do our social distancing.
Yes.
Um, I went to the store
Mm-hmm.
this weekend. Of course, we have to go to the store. We have to pick stuff up, and I'm staying away from people. But what
Mm-hmm.
I'm still, for the most part, I am
Mm-hmm.
seeing people doing a fantastic
Mm-hmm.
job. But I'm still seeing groups of people go in.
Mm-hmm.
Mom and dad and the kids, or a couple of guys go in together, a
Mm-hmm.
couple of ladies go in together. I did see more masks this
Mm-hmm.
weekend, so that was good. But just remind people, I just want
Mm-hmm.
people to remember not to go in as group.
Mm-hmm.
I think
Yes.
that's pretty something to think about. So
Yes, absolutely. Very important.
okay.
Yes. My husband went to the store this weekend. He wanted me to go, and I said, "No, you're gonna have to go by yourself. It can't be a social thing anymore.
Right.
It can't be our social outlet. It has to be minimal
Right.
people out there."
Yes, ma'am.
Hmm.
And I did hear that just a little while ago, someone was telling me that the employees, or
Hmm.
I think it was at Walmart, were telling people you need to separate.
Oh,
So
good,
they
good.
are, Walmart and United
Hmm.
are doing a great job as far as that goes.
Excellent.
I went into O'Reilly a while back, and they are
Hmm.
doing a fantastic job.
Hmm.
They're wiping down everything.
That's
As far
great.
as people are
That's
there, they're
great.
keeping people 6 feet
Hmm.
apart. So, um,
And all those efforts, they're hard, and we're asking people to do things that we've never asked before,
mhm.
but they really are important. And all those little decisions to do those changes,
Yes, ma'am.
they're going to add up to, and it's going to make a change. It's going to make a difference
Absolutely.
in what's coming.
Absolutely. Well, thank you, Kathy. I
You're
appreciate you being
welcome.
here. Was there anything else that you wanted to bring up, or
I
you think
can't
that, okay.
can't think of anything.
Okay.
Thank you.
All right. Well, thank you, everybody. We appreciate you watching. Hope this helps you in some way. If you have any questions, we're going to try to do this daily. So, at least for the time being. So get us some questions, and we'll try to get them answered. Thank you.